Hi, good afternoon. I'm Gail Hunt, the head of the National Alliance for Caregiving. And so I've been asked to talk a little bit about the vision for home health as it relates to family caregivers. And I've been just so excited all morning because everybody has talked about the patient and the caregiver. And that's exactly what we need to be thinking about, how those go together. Or as at PCORI, the Patient-Centered Outcomes Research Institute, we always think of the circle has the patient and the family caregiver in it, and then around the circle are the home health providers and the physicians and the other therapists and all the other health providers. So that's really an important concept, I think, that everybody seems to have picked up on. The one thing I'd say is that we need to think of the family caregiver as a member of the team. The team that Tom has been talking about, the interdisciplinary team, needs to have the family caregiver because they're going to play a big role in helping to implement whatever the regimen is, the diet, the exercise, the medications, whatever is expected. That's going to be partly what the family caregiver is going to be responsible for. So they really should be part of the team. I think we should be building models of care that really are patient and family centered, not just kind of paying lip service to this idea, that we need to identify some models of care that are scalable. My concern is that some of the wonderful ideas that we've mentioned today, they're really, I was going to say, they're really small pilot projects and good ideas that would work only in a small segment of the population. We need to think about the 5% who's out in all of the communities in the country, or the 10%. We need to have a way to identify who they are. I think it's probably easier to identify them maybe in the VA, but identify who they are and actually to have plans to how do we have a big scalable way of addressing those people, particularly with the family caregiver included. And I think we can learn from states that have made strong home and community-based care programs where they've brought in not just the medical side, not just the physicians and the other healthcare professionals, but also transportation. If they can't get to the doctor's appointment, then the whole system kind of falls apart. And we've talked a lot about that today. The considerations that we need to take into account: multiple chronic conditions, as Tom had his great chart, and then Alzheimer's, of course, which is now the 6th leading cause of death in the US and, kind of gaining on us. I guess if you go to enough Alzheimer's meetings, you start looking at everybody around you and say, could be me, could be them, what is it? Yeah, exactly. So we need to be thinking about not only home-based care as skilled nursing, which is what we've really talked about a lot today, home health, but the non-home health, the non-health, the non-medical care that organizations can provide as well, that provide the personal care, the companionship for people with Alzheimer's. We need to be sure that that's part of what we're considering when we're thinking of home-based care. I think that we should look to the skilled providers of home care to be people to train the family caregivers. So I think there's a real role here that hasn't been talked about a lot, for the family caregivers to learn from the nurses, to learn from the nurse practitioners, even from the skilled healthcare people that come in, to learn how they can deal with the issues that they have to deal with. I also think that somehow the home health should be playing a role, and somebody touched on it, I think, that it's very early this morning, in assessing the ability and willingness of family caregivers to provide these services that we're all talking about pushing on to them. So it's all about how do we get the family caregiver to do all of these things, but we haven't really thought about, is this something that the family caregiver is willing to do, or do we have to, not have to, should we bring in somebody else to help with that particular issue, like colostomy or whatever the issue is? We just kind of assume it's going to be the family caregiver and build the system around that, which to my mind we have a little bit of an issue with. And then part of the vision too, everybody else has mentioned it, is technology. I think we've got to look at not just what's going to be technology for the patient that will help them, like medication reminders and pill dispensers and passive monitoring systems, but technology that can help the family caregiver as well to organize their time, to be able to reach out to the physician and have access to what the physician has recommended along with what the OT is planning to do. We had a meeting in Palo Alto in April on catalyzing technology to help family caregivers. And that's really important, I think. How do we get the technology industry, which is eager to get the money that's there, they don't really expect it from Medicare, in my lifetime anyway, but to be able to get money from fee-for-service from the family caregiver, really, how can they get together with the caregiver so that they can design things that will help the caregiver? So just really quickly to mention a couple of the barriers that I see to the vision. I'll just say I'm not sure that we have the return on investment data yet. The research on specifically how home care for the larger population will work. Clearly they have it in the VA for that specific home care population that Tom's dealing with. We've talked about the Medicare restrictions, like the homebound issue, and how that can be adjusted. In telemedicine, I know that there are restrictions also, some of which have been mentioned about rural and frontier areas, and you can't get reimbursed for telemedicine in urban areas where it might be useful to reach out to do that. And there was a meeting maybe 2 weeks ago on the Hill to really discuss that. What can CMS do to change its regulations? The FCC and the FTC, actually, those were the three agencies that were represented, but specifically on this topic. I think we could learn from other countries. There are countries that they have different payment systems for medicine, but they have systems that can help family caregivers, and they've overcome some of those barriers. And for example, Australia and the UK are two examples of countries that are doing a much better job than we are of supporting the family caregiver long term. And they're talking about, for example, people with children with disabilities that they're going to be supporting life for the whole lifespan. And then lastly, I'd just like to say that I think I haven't heard this mentioned today, I don't think, and that is patient-reported outcomes. That it's really important when we think of quality that we think of what does the patient want. It's not so much necessarily what does the system record that we did for the patient. It's what did the patient want? Did we reach that? And what's the family reported outcomes? What did the family want as well? Were they supported? And do we count that into quality, which I think is really critical. Thanks.